as college students, we sometimes have really disrupted sleep schedules due to stress and homework. But are we suffering from insomnia? Insomnia is a feeling of inadequate or poor sleep because of one or more of the following: trouble falling asleep, trouble remaining asleep, awakening too early, or non-restorative sleep. Now, there are two main types of insomnia, short-term and chronic, and then there are two subcategories that I will be touching on today: sleep onset and sleep maintenance insomnia. Some symptoms of insomnia include feeling tired during the day, irritability, trouble concentrating, and of course, trouble falling asleep or staying asleep. Now, the diagnosis process for insomnia has three general either steps or different types of diagnosis. The first and foremost is a physical exam, where the doctor will examine the patient to determine whether or not the insomnia is being caused by another medical issue. The doctor can also do a sleep habits review, which is when the doctor asks sleep-related questions about energy levels during the day, and they also might require the patient to keep a sleep diary chronicling when they have trouble sleeping or when they wake up, and so on and so forth. The final form of diagnosis for insomnia is a sleep study. This is generally done if they can't find another cause, or if the insomnia is being caused by another sleep disorder, such as sleep apnea or restless leg syndrome. Sleep study is conducted at a sleep center, and it records body movements, heartbeat, breathing, eye movements, brain waves, and in the patient's sleep. Short-term versus chronic insomnia. Short-term is generally caused by stress or anxiety, environmental changes, schedule changes, and can generally last a few days to a few weeks. Chronic insomnia, also known as long-term insomnia, is categorized by 3 or more sleepless nights a week for multiple months. And chronic insomnia is only diagnosed when another health issue or side effect of a prescription is not the cause of the insomnia. Sleep onset is a subcategory, which generally means that the patient has trouble falling asleep at the beginning of the night. The patient will eventually fall asleep, but it does shorten the patient's sleep time, and they do end up getting less sleep through the night. The other subcategory of insomnia is sleep maintenance insomnia, which is generally the struggle to stay asleep, or if the patient wakes up too early and struggles to get back to sleep. And this type of insomnia, any type of insomnia, can cause anxiety over how much sleep the patient is getting, and it just creates this vicious cycle where the anxiety is making them stay awake longer or makes it harder for them to fall back asleep, and then it just really, this vicious cycle continues and continues and continues. Now, there are 3 main types of treatment for insomnia. There's cognitive behavioral therapy, which is the first go-to treatment for people with insomnia, because it helps to deal with the negative thoughts associated with having insomnia, and it also teaches patients to change the beliefs that they have that affect the ability to sleep. The other 2 treatments, of course, are prescription medications and over-the-counter sleep aids. Now, insomnia is very common. I suffer with insomnia personally, just it's an anxiety related. But you can eventually fall asleep. There are many recommendations for helping yourself. If it's short term where you're just stressed out, you can, what I like to do is I'll turn on a light, not a bright light, not my phone, and I'll get out a book and I'll read a chapter of a book, and I avoid looking at a clock, and which is recommended by Harvard University. Their article on Insomnia says. Avoid looking at clocks and avoid actively trying to fall asleep. Just stay awake and try and calm your mind. So, insomnia, you can deal with it.